Now this hour, we're going to focus on hip and knee replacements, Parkinson's disease, and speech therapy for stroke patients. So let's take a look at some other issues these therapists may assist with as well. Joint replacement fractures as well. Can you talk about these, Tina?
So fracture, any patient that suffered a fracture, and whether they're hospitalized or not, as you mentioned before, they don't need to be hospitalized. So they could have just gone to an urgent care, done an x-ray, seen that there's a fracture, and then maybe have gotten casted. When they come back, they need some physical therapy in order for them to regain back their mobility, to get that strength back in whatever part of the body it is that they suffered that fracture.
Absolutely.
So it's important to receive that therapy pretty quickly thereafter.
And obviously that's tied into falls, as we see here in our next graphic as well, correct?
Right, so the main issue that we have with patients at home, because our population is above 65 and older, so we do have an advanced age clientele, falls are one of the most prevalent things that occur. It could be due to the medications that they take, or just simply because they get up in the middle of the night, maybe sometimes they're disoriented and they fall. So usually those things would necessitate an order for physical therapy to help them try and you know, do better activities getting around.